Hi there, it's Jeff Pierce again from Michigan Sports and Spine. So we have exciting news. Our goal is to break 500, and we got to 491. But the thing is I had a guest on with Dr. Bonnet, and I think that was the secret weapon. So not to insult me or upset me, I hope that we can continue that run of getting increasing number of followers and watchers. And realize and tell your friends, you don't need to watch it live. We are on Facebook under the live section where you can go back and watch it. It's on our website after. It's just on the Instagram, we're only able to do 15 minutes, so you won't be able to see it on there in its entirety. So again, I encourage you, if you do feel these are beneficial, share it with your friends, share it with whoever, because that encourages us to do it. We're also real excited because we had more questions. I keep saying it, but we're getting really good questions to the point that I get to pick and choose. And again, if I don't answer your question on live, you'd be more than happy to contact us through email, come in, anything you need, we'll be able to do. But we're trying to get to as many questions as we can. So jumping to it, I'll get to my other stuff later because we have a lot of questions, because I have a few funny stories I wanted to share. It says, where do you see sports medicine in 5 to 10 years? Mainly at a professional athletic level. Some people say these athletes' careers could lengthen in time with new medical advancements in technology. So that's really where we've been. I've been doing this for 20 plus years. We feel we've always been the cutting edge. And one of the biggest stories, just to get to something real quick, the answer to your question is sports medicine is advancing. I feel that the stem cell, the PRP, the preventative stuff, the less invasive procedures that we're doing is allowing these athletes to heal quicker and get back on their feet, back to their elite levels a lot quicker. And when we talk about professional athletes, that's just one aspect. It's such a small percentage. It's really the kids that we worry about. Even like I have one of the basketball players for Wayne State right now. He wasn't that he was misdirected, it just wasn't handled properly. It's been a year injury with a foot injury that is, can hinder obviously someone that's playing basketball to be at the elite level. So with our advancements, we're able to get them back into it. So our understanding of just PRP and stem cell, which we always push and are always very biased about, I feel there's a major benefit to that, to the healing process, as opposed to surgeries and steroid injections. But also, we're working with laser therapy, we're working with increased blood flow, there's a lot of technology that's coming out. So the technology is not just making the careers longer, it's allowing these young people, there's so many stories that we have. I'm in the field, with NBA players and NHL players, and they're like, whatever happened to this guy? This guy had a career-ending injury. Well, those career-ending injuries are becoming less and less because we're able to treat better. We're able to create a more preventative program. The other huge thing is the training. Now, I do have a beef with the training because you have to be sport specific, but for a young youth kid, you have to worry about cross-training. You have to take into account that age group of growth. So when you're talking about puberty and adolescence and growing, a lot of kids are damaged right there that you don't feel the effects when they're a young teen, but when they turn 17, 18, 19, you're seeing career-ending injuries and unable to make that next step. And it's, you're getting so competitive now, it's even like the track field. We're going out in track fields, we're measuring to the 0.00100 to determine the winner. That's how much difference there is. So in your training, those fast twitch fibers, there's just such a small level of competition that you can continue to fight at to still be competitive and make it to the next level. And every professional athlete, they'll tell you, there's so much regulations now, but every one of them every day is learning to try to decide what is that next step that'll put him to the next level. The guy who's at 25 and he can do everything, and well, now he's 32 in his career, and they're talking about he's an old man in it. He doesn't believe that, he needs to keep going. So a lot of the stuff we're doing is advancing. So to simply answer your questions, sports medicine is continuing to advance. That's why I'm more excited. Here, 20 years into my practice, I'm more excited about stem cell PRP than ever. It's giving me back to youth, and adding the new doctor and the young physician assistants that are coming to our office now and working It's just bringing a whole new energy of what's going on and excitement that we're able to be still at the front edge of all this. So one quick story, Tim Duncan, I don't know if you guys know who that is one of the best players ever to play. I think he was number 11 or 14 on the all-time list for best players ever in the NBA. San Antonio is a friend of mine, and back when PRP just came out, his knees, if you followed his careers, his knees were deteriorating to the point that he thought he was going to end his career. This guy's getting paid a ton of money just in playing the game, but also in sponsorships. He probably went another 3 to 4 years, which he credits, I think it was in Sports Illustrated, with a doctor talk to him about this PRP injections, which he tried through the San Antonio team doctors, which he encouraged him to do, and he did. He said he felt better. His knees expanded his career. So it's a major difference, and the things that are going on are allowing these athletes to train better and be more preventative, which is really what's going on. And also the training. You'll see athletes where they're in their 20s to 25, they're like, we didn't really train, we just went out and played, and we didn't understand our bodies. Sometimes they have an early injury that does it, and sometimes it's age that does it. So there is crazy advancements, especially like with some of our even our dietitian that works with the Red Wings. The stuff that she's doing at the level she's doing it is crazy. And we're bringing it, and through Michigan Sports and Spine, we're bringing that kind of technology down to everyone. You don't have to be the elite athlete. You can be the college athlete. You can be the weekend warrior that's like, Doc, I gained 10 pounds because I didn't do any, I got to work this job and I can't work out like I used to, but I still want to play. We have answers for you for those issues. We're not all about the catastrophe accidents. We love treating those type of injuries where we can get you out ahead of the game. I mean, I'm pushing right now. Actually, before I had to hang out with my last patient, he's had ongoing back pain for 15 years. It's a nagging thing. He's talking about doing PRP stem cell to prevent it. Even though he's feeling good right now, this is really the time where I want to do the PRP and stem cell. We don't do it at the height of your discomfort. We do it when you're recovering. So we're getting more benefit, so it's becoming more beneficial. It's not really what needs to get you out of the pain, it's when you're healing. So that's a long-winded answer on that. So we'll go, again, it's a non-surgical, the advancements, even the surgery, I have to do a shout-outs to the surgeons. They're minimally invasive procedures for everything that's being done. The recovery, the rehab that we have to do, is so much far advanced, and we're ahead of the game because we're not dealing with such deep cuts and muscles being resutured and all that. When you're minimally invasive, you don't have to tear through so much of the anatomy. So hopefully that answered your question in a long-winded way. I'm new to your live episodes. What made you choose your specialty? Did anything influence you in your career path? So this is not a short answer. I picked my specialty. One, I wanted to be an orthopedic surgeon, but because of my back issues, my personal physical issues, it limited me from being able to do that type of residency. I was in severe pain through my medical school internship, and which drove me to sports medicine, physical medicine rehabilitation. What drove me most is my training in Chicago. I was considered, kind of one of the top residents coming out of Chicago, which is, in Chicago has the most PM&R residents in the country. So it was exciting to have that many colleagues working and studying at the same level. And I felt then I had to separate myself from them. And I had a passion for sports. One, because I tried to play and I hurt myself. And two, I had sympathy for injured athletes. So it was a perfect mix. And then developed my charity called Athletes Unlimited, which are for impaired athletes, which were probably one of the biggest organizations, support groups for charity, which I have to do a plug real quick because our golf outing is coming up on August 10th. I'm actually wearing the Athletes Unlimited logo. I'm wearing this shirt on purpose, and I was planning on doing this at the end, but it's more appropriate now. But it's our biggest way of sponsoring our impaired athletes. If you're watching any type of impaired athletes from basketball, softball, tennis, we sponsor all that, and we've been able to do that for the last 24 years. So that came out of my residency also. So to answer your question, there's an internal passion. Like I say, before all this craziness going on, you gotta love your job, and I really love getting people better. Like right now, people are like, you've been around long enough, you're looking to retire. I'm looking to retire from the paperwork. I love, being able to figure out what's going on with patients, hearing that, I went to 4 other doctors, they didn't have a plan for me, I came here and you got us better. And it's not just a two-hour horn, it's when you have the proper tools, proper education, you're in the proper physician's office, it goes smoother, things happen better, the treatment's better, everything just happens. And that's really where we try to pride ourselves in what we're doing. And bringing in Dr. Bonet, I think, is a great asset. And teaming up with Dr. Abrahamson, who has a long career also. And look, she's also on the cutting edge of her specialty also. So, did anything influence my career? It's really probably my early injuries. Number one, the passion for I have just more abilities with rehab and sports medicine. So it's called physical medicine rehabilitation. So the physical medicine part is really where I've played a larger role. When I first came out, I was the first one to be doing injections. I was the first doctor to deal with any type of professional athletes. I think I still am in the PM&R field. And to be able to be, the rock doc and relationships with every team in the city. Obviously, there's other politics going on, which I've gotten tired of playing. But for right now, we're real comfortable at the position we're at, and I feel I've been a thought leader in that field ever since I came here back in 1996. So question 3 from a former patient. I remember your Troy office being pretty cool, getting to watch players on the rink. What is it like working there? You should do an office tour. So they're talking about my office that we built in 2000 at the Troy Sports Center. It was a brand new center with a huge training center with the Red Wings. And I was asked to build out the sports medicine section with Henry Ford Hospital. Since that time, Henry Ford Hospital ran into some of their own issues at the time and were unable to kind of follow through. We decided to continue that. And it's a very unique setting. My office sits above the ice skating rink. And it used to be the ice skating rink where the Red Wings would practice back in the day of Scotty Bowman and Yzerman and Fedorov. And Fedorov's in my office sitting in the big chair. So there's a lot of great stories there. It is a fun place to be. It's a different atmosphere. We've been criticized because it's not a typical doctor's office, but as I've proven, I'm not one of the typical doctors, so why should I be in a typical doctor's office? So we will try to do a tour there. We think that's a great idea. We're actually toying with, and we'd love feedback from you, that we want to start doing podcasts from this. And before the pandemic, we actually talked to people where we're going to do on-site podcasting. So one of them was actually going to be in the middle of the ice skating rink with Mickey Redmond, and unfortunately it's been put on hold. So that's still something we want to do. So again, we'd love your feedback if that's something that would interest you. I do a lot of charity. For anybody that's been watching my career path and my radio show, we always talk about charity every week. So what we were thinking is doing podcasts from like a 5K, from a Mutters, from whatever it is, one to promote the charity, but also to get different viewpoints and get right down to the the people. We want to get to the people and get those answers. So we are working on that. So other ideas we would encourage. So we're going to put number 1 down as doing a tour and a podcast from the Troy office. So number 4, what motivates you to stay so physically fit? I think the person that asked this question should get their eyes examined. As far as physically fit, maybe I just look large on screen or something, but I'm nowhere near where I need to be. And granted, I'm a little bit older, and to be honest, I'm doing the same workout that I was doing 20 years ago. I've tweaked it a little bit, but trying to lift the same amount of weight, the same amount of time, but I do cheat it a little. When I do my bench pressing, I don't come all the way down to my chest all the time. I kind of cheat to here and just get it back up there. But the problem is I don't like working out with anybody, so I don't want to get the weight stuck on my chest. So we've been pushing for that. So honestly, it comes from a story from medical school. And I've told this story so many times, and I tell people from, everybody's got a similar story, and we'd love to hear your story, but it's the person that keeps spending his time promoting something and not living it. So I had our cardiologist in medical school, and we would sit in this big auditorium. It would be a 2-hour lecture. We would have to take a break every 40 minutes. And the biggest reason we had to take the break is so he could go outside and smoke. So from that moment on, we had another teacher say, you get to learn what's good and bad. You have something to learn from every physician that you talk to, every senior resident, every attending. So it's always not the positives, it's the way you want to practice. And I had this family practice doctor in New Jersey teach me, pulled me aside, pulls out Good Housekeeping. For a lot of the young people, viewers, you probably don't even know what that is, but it's a magazine that people would read, especially stay-at-home moms or females, and I'm not being sexist or anything, but it's more like that's reading it, but that's where they would get their information. He says, if you weren't smarter than Good Housekeeping, then you're not worth anything. Meaning you need to stay current on what the people are getting. Like, what are they getting off Facebook now? What are they getting off of CNN's comments? You've got to be able to react to that and know that. And it's the same thing here, is that I need to know what's going on. I need to be I have to preach live what I preach. So I need to stay fit. I need to stay working out. I need to be very active. But it's also because I feel better. When I don't work out for a couple days, I feel sluggish. I feel crappy. And it's the energy level. And the energy level that you need is important. Like I have a couple days, especially with COVID. I have the responsibility of my office and other things that we do. There's a lot of stress, and you've got to come in with a great attitude and positive. But some days it gets to me, and then you don't want to work for a couple days. So when I have patients say, "Look, I don't feel good, my back hurts," everything like that, I get it. Don't think I'm not being sympathetic when I say, like last week, no excuses. Life is real. Life's not easy. We get it. But the thing is, if I let you be defeated and not give you avenues to just get up and get back on your feet, start activity. I have so many people that just, I'm going to start tomorrow. There's no reason for tomorrow. The reason is today. I took 2 days off for a lot of stuff going on with the office in the last couple of days. I haven't been able to work out. So this morning I'm like, I stayed home. No lie, I stayed home an extra hour just to work out so I feel better. Because to be honest, it's to you too. I have to bring, I want to bring an energy. I want to bring that whatever you call it, that X factor that motivates you. If you're going to a doctor that's like going through the motions and just going blah 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 blah, how's that motivating to you? And especially if he doesn't look the part. There are so many people that upset me. I was going to say piss me off, but Nicole was going to push the buzzer. So there are so many physicians that sit there and preach this game and don't live it. The only other person I can really do a shout out for is Joel Kahn. Joel Kahn's, I don't know what he's doing in the social media right now, but he's stirring it up, so I'm going to stay away from him. But that guy is the only other person that I know at a first-hand level. Actually, I know another one too. But on a first-hand level, that's truly living it. The guy's a vegan. He's living heart smart. He's pushing it. He's promoting it. And to be honest, kudos to him because he's saving so many lives by people that are being influenced by him. I would encourage all of you to at least look up what he's doing and at least try to understand it. Another one is Dr. Kordowitz, Mark Kordowitz. He's a big orthopedic sports medicine guy who has been doing marathons and triathletes since before his physician. So that's 15 plus years. He's living it too. So these guys are fit. I try to never look back. I'm always looking to improve. Even teaching my kids right now, it's not what's behind you, it's what's in front of you. Tomorrow's tomorrow. Today's today. You need to focus. Yesterday already happened. You can't change it. But that doesn't mean I put out positive messages to my staff, and it's not about what was going on yesterday. It's what you want to do today. How you going to resolve it today. And the other big thing that I just put out, especially since we have new people because of the COVID, we lost a few people. But I put out, and I think I got a little smirk back, is that I'm looking for overachievers. I'm looking for overachievers that are welcome here. People that want to wait till tomorrow can, take a back seat. And it's just with everything with life, you have to do it. So being fit here is, I feel I need to show it. It's hard for me to continue to work out. Days are busier with COVID and everything going on. We actually have less time going on. So long-winded answer, trying to be a little too deep on that, but hopefully I answered your question. So the last one brings up, it's a great thing. I talked to your PA and your new doctor at the office during my last appointment. They were very nice and polite. Do you have any advice for similar newer healthcare workers pursuing sports medicine or pain management? Asking for my granddaughter. So this is a really cool question. This is like, at multiple levels. It's one, it's you're respecting what we're trying to do, which, I get a little emotional about, but also that you're thinking about your granddaughter. What I've always done, and people that have been in my office, I always have young doctors here. I have kids that are in high school. I have kids that are in college. My name's on a list that I'd be happy to be a sponsor or a proctor or whatever they're calling, a mentor to any of these kids, because like I said, I don't like residents that come here because they think it's an easy rotation. I like residents and being able to teach to people that are truly interested, because it's funny, being in my position or being in positions that I've seen other people before me, and that's where I've shaped my personality, is that you don't realize the little things you might say have a big influence on young people, and it's older people too. I mean, it's just, that's why you're careful with the way you put your words. And sometimes I make excuses, but to be honest, I'm straightforward. I'm very straightforward. If you really want to do it, this is what you need to do. I'm not going to sugarcoat it. I'm not going to play around it. So if your granddaughter is seriously interested in trying to do sports medicine or pain management, I don't know her age. Hopefully she's at least in the college range. But I'll be happy to have her come here and rotate and get time with me to ask any questions she wants. So, with the craziness of the world, we're still pushing forward. We're seeing more patients in the office. We're open for new patients. Like I said last week, Dr. Bonet's starting. It's going to free me up for more people. We think we have a rhythm with everything going on in the office, and our new doctors are helping out. So if you have people that need to be seen, want to talk to me on telemedicine, need a consult, just aren't getting to where they need to be, we're available and willing. Again, it's from a non-surgical, non-narcotic standpoint, but we want to push, that we're going to create a solution for you. If we can, I'm going to get you to somebody that can. And I really appreciate it. Peace out. The world's a little crazy today. Let's find some love in it and hug your neighbor.